Hello there. It's my distinct pleasure to have on our show today as our guest, Ms.Preetha Reddy. She's Managing Director of the Apollo Hospitals, and we've really been tracking her down for many months to actually get her to be on our program. Of course, the Apollo Hospitals have carved this name for themselves in our country as the leading healthcare institution. Welcome to our program. Thank you for joining us on We Connect. Preetha, thank you very much. I know I've been hounding you for many months, but let's start by saying congratulations to be in the top 50 influential, powerful women in international business. I mean, when that happened, I'm just wondering, was it just another thing for Preetha Reddy?
Well, no. First, sorry I made you wait so long.
It's our pleasure anyway to have you on our show.
But Jennifer, it's not me, 50 most powerful women. If I'd been a man, they may not have featured me, number one. But I think it's just the work which has been happening, 65,000 people contributing to being a good healthcare provider.
Right.
Our chairman who really eggs us on all the time.
Right.
I think that's what really made that happen.
So you would
so it's
believe...
more like, I'm glad there was recognition for Apollo more than anything
right.
else.
So you would say that this is really a direct reflection on where Apollo Hospital stands in our country today. Would you say that?
I think so. And if people are saying, recognizing Apollo, saying good things, we must understand that, it was two things which made it happen. It's the kind of people who we have within the system. And it's the patients who trust us, who come to us from, all over the globe, literally.
Right.
So I think it's because of them that
Right.
there's recognition.
Preetha, how does it feel to be actually running something that is a household name? What does it feel like being the managing director? It's no mean task.
It's like running a large home, basically.
Is that so?
Because you have to...
That's simple. No, you're making it sound simple.
Sometimes I think the home is more complex.
That's true.
Because they don't listen to you as much.
Yes.
But, when you put your heart and soul into something, and when you wake up in the morning really thinking of, okay, this is Apollo, what can I do? Where do I pull up somebody for something, or where do I give back? We don't know better,
right.
really speaking. It's part of our DNA. We grew up doing it.
Yes.
So it just kind of feels seamless. It doesn't feel like an effort to run Apollo at all. Because I've been asked this question many times, and it's just so much part of all of us, either my parents, including my mother,
yes.
My family, and now my children. When four of us sit and speak, we only speak about the hospital. When the kids are home now, we're speaking about the hospital, and I didn't realize how much it's really part of our DNA.
Right.
So
you
it's
live,
not like running something.
Right. You live, you breathe, everything you do revolves around the Apollo Hospitals. But for 10 years, you sat at home before you actually took over the mantle. Am I right?
Not really 10 years.
Quite a long time though.
A long time, yeah. 5-6 years.
Okay.
And then we started working, but we're so fond of telling my father that we were cheap labor.
I'm free.
We were
Probably free labor.
Yeah, at that time he needed all the help he could get. And as girls it was like, whatever my father wants, we're there to do.
Right.
And in a way it's still the same today. But the thing is, we just enjoy what we're doing. All four of us, because, we're equals. We work within the system, and each one contributes in a different way.
Right. This I do believe is the outstanding quality of Dr.Preetha Reddy, because I've had the opportunity of interviewing him as well on this program. He passed on, or he has passed on his skills, his expertise, his experience to all the daughters in all his 4 daughters. And when you look back, don't you think that's a wonderful thing, Preetha?
As a person, he's very giving. You can go to him with anything you need, and he's always there to give. So I think he's really given us the best of our skills, because none of us went to business school. We learnt on the job, and literally from the basement upwards, because all of us were made to work, either in the kitchen or even understand how important the housekeeping of a hospital is, as much as the finances of a hospital should be. So I think we've learnt on the job, and he's made us do that. So
Right, but
I'm so thankful for that.
But he taught his daughters. Normally in our country we tend to think of sons and, you know, and other male members within a family setup.
Yeah.
And here we have this empire that rests very, very safely, very securely in the hands of his 4 girls.
You know, he's a bit different from the regular Indian head of the family or the Indian male, and he gave us a great opportunity to be able to perform. I don't know, I mean, if there were sons, I wonder what they would have done. But I think the girls have this, you know, this extra connection with the father.
Indeed.
And when we were young, and a lot even now, we just do it for him, you know. We do it, we don't think twice. And it's worked out very well.
Right.
And we can have like a great dialogue with him. So sometimes I think it paid off being daughters and, you know, the girls doing